Good morning. Welcome to our coronavirus COVID-19 virtual information session. We appreciate you all joining us this morning. Your microphones will remain muted during the session, except for the speaker. So just wanted to first let you know who I am. I'm Barbara Gordon. I am the Director of Community Engagement at the Traeger Institute. And I'm just going to share a few things with you before we get started. Guest mics will remain muted. If you need access to your mic, please message a meeting host. Questions, if you have questions, which I'm sure you might, please type them in the chat. We will answer questions asked via chat at appropriate times during the session. And please use respectful language. We strive to create a safe space for community conversations. If you experience any inappropriate behavior in this session, please message the host immediately. And if you're concerned about your health, we have numbers here on this slide, and we'll show numbers again later during this session where you can call to get information about assistance as it relates to COVID-19 as well as other health issues. Some other helpful tips we like to make mention: if you're having difficulty with your sound, please go down to the mute button. There's an arrow there. You see it in the yellow circled on this slide. If you click on that arrow, you'll find information that can assist you with your sound. We also like to have information about who you are and where you work, where you live. Please type your county into the chat box for us. That just provides us with good information that helps us with our reporting requirements, as well as to know who we're reaching in the state. So again, we welcome you. Before we get started with our presenter today, who we are very excited to hear from, we're going to receive our COVID update. And Dr. Christian Furman is going to provide that for us.
Hello, welcome everybody, and glad everybody's here. Yes, I'm Dr. Christian Furman. I'm the medical director of the Traeger Institute. So I just want to kind of give you a few updates. First, I'm going to start with the nursing home. So the nursing homes officially, on July 15th, were able to open to visitation, but it was nursing home dependent. Each nursing home would decide based on its own number of cases and how they wanted to do things. So you had to be COVID free for, I think it's 28 days. So not every nursing home is COVID free for 28 days to even open. So just check if you want to visit a loved one, check at each facility for their actual rules. But the guidelines were that they had to be supervised visitation, had to be 6 feet apart, had to be like in the entry part of the nursing home, not back in the bowels of the nursing home. And so that's the same for assisted living and personal care. So that's starting to happen at each facility. A lot of them are having people signed an agreement saying, there's never zero risk and there's risk involved in visitation and all these details. It's really hard in the nursing homes because it's requiring more work, to get the patients to the visitations. You have to wash your hands beforehand, you have to wear a mask. So the nursing homes were stressed because of all that. Also, I think it was Thursday afternoon at the press conference, the governor announced that the nursing homes are now going to have maintenance testing. And so the state government is going to pay for every patient and staff to be tested every 2 weeks at the nursing homes. So, we did testing of every nursing home just to get a baseline of who was positive, who was negative. And now they're going to maintain that testing every 2 weeks. And I think it starts, I'm not 100% sure, I think it starts August 1st. So right there is going to require more staffing, more work for the staff, because in the past, Norton's kind of had a contract for the state to go around and test all these nursing homes, but now it's up to each nursing home itself to test itself. So every 2 weeks, the whole facility will be tested, staff and patients. Which is great. I mean, it's a great thing. So that way, a lot of the older people are the ones that are dying. People in nursing homes are the ones that are dying. So this is a way to keep everybody healthy. Also, yesterday the governor announced 4 new items that we're going to implement to keep the state of Kentucky healthy. You know, our positivity rate at first was 2%, then it went to 4%. Now it's like 5.8%. So our positivity rate's going up. And when it gets over 5%, they recommend they implement these. And this came from the White House COVID task force that recommended everybody have a mask. Well, the governor had already done that. Limit grouping to less than 10 people. He'd already done that. But the two things they said yesterday is, one, bars are going to close for 2 weeks, and then restaurants are going to decrease their indoor seating to 25%. So those are the big changes. And also, just to let everybody know, yesterday they gave the numbers, and new cases were 522 and deaths were 9. At one point, the new cases were like 900, I think, on Sunday a week ago. So, 500 is better than 900, but still it's a lot. So our numbers are going up in Kentucky, just like it is throughout the whole country. The total number of deaths in the state of Kentucky is 709. And of all those, 353 are 80 plus and 175 are ages 70 to 79. So definitely the people that are dying are older people. At University of Health in our system, Jewish, U of L Hospital, Mary and Elizabeth Peace, there's 24 positive cases, which has been about the same through U of L. And U of L has actually had less cases than like Norton's and other health systems, which has been good. Kroger is going to stop its drive-in testing. Instead, they're going to have the testing in the little clinic, and the governor's looking for a replacement for Kroger to do the drive-through testing. The governor also recommended yesterday that he recommended schools wait till open till the 3rd week of August to start in person. So it's really up to each school system to decide how they're going to do it. The governor also issued a travel advisory, and they looked at the states that had a positivity rate of 15%. So Kentucky's 5%, but some of these states are 15%. And if you travel to those states, they recommend a 14-day self-quarantine. And Alabama's at 19%, Mississippi's at 21%, Arizona's at 23%, Florida's at 19%, Idaho's at 17%, and South Carolina's at 16%. And states that are right on the cusp is Georgia's at 14%, Nevada's at 14%, and Texas is at 13%. So there's a lot of, stuff happening definitely out there with COVID. So that's just a few of the numbers and a few of the updates. And then we can, I can take questions at the end.
Thank you, Dr. Furman. So we are really excited today. Our topic this morning is COVID-19, exposing intersectional and systemic inequalities. And we are excited to welcome guest speaker Lyndon Pryor. He's the Chief Engagement Officer at the Louisville Urban League, for a conversation about the impact of COVID-19 on the African American community. In particular, this conversation about the impact of COVID-19 will explore how the current pandemic has exposed deep inequalities throughout society, touching everything from medical care, unemployment, housing, police violence, gun violence, and systemic racism. We will also discuss how the Louisville Urban League is working to address the intersecting injustices brought to the forefront by COVID-19. Lyndon Pryor is the Chief Engagement Officer for the Louisville Urban League, where he works to enhance the smooth and efficient integration of all services at the organization to maximize the potential outcomes for every league participant. Prior to his work with the Urban League, Lyndon served as student development specialist at the Texas A&M University, where he aggressively worked to support students through crisis, design and administer programs that assist college students in I apologize. I'm in a room where the lights time out. Sorry for that. So let me finish. While in Texas, Mr. Pryor also co-founded and ran a nonprofit youth development organization targeting African American high school students with an emphasis on identity development, intercultural competency, goal setting, personal and academic achievement. Mr. Pryor is a proud former student of Texas A&M University, where he received a degree in political science. He also received his MA in education in Human Development from the George Washington University. So we are excited to have Mr. Pryor, and we're going to give it over to you, Mr. Pryor. Thank you.
Thank you very much for having me. It is a pleasure to be with you all this morning. Again, my name is Lyndon Pryor. I'm the Chief Engagement Officer at the Louisville Urban League. And I'm going to talk briefly just a little bit about what we've seen and kind of what we've done. But to be very honest, even in this Zoom platform, I much prefer engagement. So I hope to leave as much time as possible for us to be able to dialogue about this topic and at least what we've seen from our vantage point at the league. So just a little bit about the Louisville Urban League. The Urban League has been in service, particularly in this community, for 100 years now, assisting Black people and other marginalized populations achieve social and economic success. And for the past 5 years, under the leadership of our current president and CEO, Sadiqa Reynolds, we have done this holistic work under the banner of jobs, justice, education, health, and housing. We have programs and services specifically geared towards those particular 5 areas. And it's through this work that we were particularly able to see the devastating toll that COVID might have from afar. We recognize the possibilities or the potential problems of COVID-19 kind of from a long way off. There's an old saying that says, you know, when white people get a cold, Black people get the flu. And COVID is unfortunately a true example of what has happened. And this is beyond just the physical effects of that occur for those who might contract the virus, right? We know that there has been a disproportionate impact on the African American community around the country and here in Kentucky with regard to contracting and suffering under the virus. But for us, it was much more significant than that, because we knew that there were going to be a lot more impacts beyond the physical health and well-being of individuals with regard to this virus. And so we began immediately thinking about, and I can remember being on a staff meeting with our leadership team, actually on the day that JCPS announced that they would be closing schools back in March. And we began to have conversations. We had already began to have conversations broadly as we were seeing what was happening around the nation. At that time, it wasn't quite clear what the impact on Kentucky was or what was happening then. But when JCPS canceled, we knew that there was going to be some significant problems and issues for our community. Economically speaking, you know, unemployment has been a problem. It's been a problem, obviously, in every community. But if you look at the numbers, there's been a significant uptick in unemployment for African American communities, which means that loss of income is having a disproportionate effect on individuals who are already, in many regards, perhaps struggling. We have in Louisville, in particular, a Black community that has been disinvested in and that has been denied access to wealth opportunities for decades, for a very, very long time. And so when you already have an absence of wealth that has been denied on top of economically stressed communities, dealing with a whole host of other things, everything just tends to be exacerbated from there. So economically, we knew that this was going to be a problem. We knew that that was then going to feed into housing. We already have an affordable housing crisis here in Louisville, where we don't have enough space or enough homes, affordable homes built for the individuals who need them. And so we were going to run into, as we have, individuals who are no longer able to make rent. And so what is that going to mean for those populations, folks who are not able to pay their utility bills? What is that going to mean for them? And thinking about that, yes, there was a moratorium on evictions, but that moratorium will end August 1st, and eviction court will reopen. But you still have individuals who are months and months behind on their rent. So what does that now mean for them? What does that mean for their landlords and their property managers who are going to begin eviction proceedings for individuals and families who have not been able to pay their rent in the past 4 or 5 months? What is going to happen to those folks, for people who cannot pay their utilities? Utility moratorium is in place through September. But again, if you haven't had a job for the past 4 or 5 months, your ability to pay your past due utilities is significantly impaired. And even if you got a job tomorrow, the idea that you would be able to pay 4 and 5 months of back utility pay or back rent pay is going to be significantly hampered. And so how are we handling those individuals? We may likely see over the upcoming months a significant rise in homeless population here, which we already have a significant one in the city. And so these things were things that we could foresee. Food access, again, you don't have money, your ability to access food on a regular and consistent basis. You add to that the fact that folks were hesitant, scared, or simply just told not to be out regularly amongst crowds, amongst people. Again, leads to people's ability or inability to access food on a regular and consistent basis. And so again, in the West End of Louisville, which is already a food desert, as are other parts of our city, when you have individuals who are not able to readily access food and who are now going to be even more dependent on pantries and other types of assistance, stressing those systems out beyond what they already are, because Dare to Care and others would tell you that their systems were already maxed prior to COVID. And so you dump a whole bunch of other people into that system looking for support. Again, you've got a significant issue at hand. And then on top of that, you've got a rise now in violence. The Courier's done a few articles on that, talking about the uptick in gun violence, and we are ahead of where we were a few years back, where we had a record year. And as unsettling and heartbreaking as that is, unfortunately, it is not terribly unpredictable, because we know that where there is, again, an absence of wealth and opportunity and financial stress, among other types of stress, violence is high. That is true for every single community. If you can put those things together, then you will have high rates of violence. It does not matter the race or ethnicity or the location of those communities. When you put those things together, you're going to get increased rates of violence, and that is what we are seeing now in Louisville. And that is all, again, before we even get to the impact of education. Right? So what does it now mean to have folks learning remotely at home, which is not everybody's primary way or mode of learning? That in and of itself is just difficult, assuming that you have access to the technology you need, that you have access to high-speed internet the way you do, which we know that we have incredible inequities in that regard, that we do not have families that have enough technology, enough computers for if they've got multiple kids who are attending school, that they don't have enough bandwidth or bandwidth at all in terms of high-speed internet access to be able to access that work. And so the stress and the strain on our educational system, and for those families who need to be, who already may have needed some assistance or equitable solutions for them when they were in school, again, that is elevated exponentially with them now being out of school. And then you come back to the medical industry and medicine in general, and the inequities that exist there. So obviously we have the thing with Black people having lots of underlying conditions and comorbidities. Those things already exist, and there's tons of research that get into why that is and the disproportionate impacts that are happening there. But we even look at more so in terms of just access to care, who actually has access to regular care. And then beyond that, this underlying, which I think is probably a long-standing problem, trust in the system. And so when you were talking about a community that has a long storied history with distrust and mistreatment from the medical community, the idea that now we are facing a 1 in 100-year pandemic and we're supposed to just turn around and trust the folks who we have had difficulties trusting before. I use the example all the time of when I started this job. My first role here was to start our community health program. We utilize community health workers to assist members in community for lots of various things, not just medical issues, but all the social determinants of health. We are doing everything, like I said, jobs, justice, education, health, and housing. And one of the first clients that we had was an individual who had a gentleman who was in his early 50s, had diabetes. He was already an amputee of one leg, and he lived with his mother. His mother called and was just deeply distressed because he was depressed and was sitting there. He had an infection in his other leg. He was sitting there planning to he was eating dinner. She said he was very depressed, despondent, and he was planning to go to the emergency room the next day where he was certain that they were going to amputate his other leg. We contacted the gentleman, our community health worker, reached out to him and went and had a conversation with him. And, and just asked, why? Like, why have you not contacted your doctor? Do you have somebody? He's like, oh yeah, I have a doctor. But he doesn't listen to me. Right? We had an individual who was, he said basically, I do not, my doctor does not listen to me, right? Like I don't trust him. I don't, there's no reason. So he was relegated to just let his leg be amputated. Well, we worked with him, and actually worked with him to find another doctor. Actually, it was the surgeon who had amputated his first leg. Got him an appointment, got him in, and they were able to save his leg, right? But I use that story to illustrate the fact that you have folks in lots of different conditions, and his story is not unique. We've had several individuals to talk about just the absence of trust and care from their provider. And so what is that doing now in the midst of a pandemic where folks may actually need to be going to the doctor, where they may need to be seeking out medical care and support during this time for themselves or for their family, if you don't have a trusted provider? What does that mean? What does that mean in the midst of testing? The Urban League is partnering with the University of Louisville as they're applying for research grants to talk about how can we elevate testing numbers for COVID-19 within the Black community, and how do we address that? Well, we know the importance of this. If there is going to be a vaccine, if there's going to be treatment, we certainly need to make sure that it is available and that it responds well to those in the African American community. It is hard to do that if they are not in your testing sample size to be able to do that. But at the same time, when you look at the history of medicine and what has been done to African American people around research and testing, you cannot blame people for being hesitant and reluctant to engage in that type of research. Just because there's so much there. And so this is an incredibly complex issue within our community and the way in which it has hit. And so there are lots and lots of layers and lots of intersections in the way this is impacting us. And like I said, it is far beyond just what it's going to mean for health. And everything that it is impacting is going to persist well beyond the day we have a vaccine. Because again, we could have a vaccine tomorrow. That is not going to help people pay that rent that they haven't been able to pay for 5 months. It is not going to necessarily put food on people's table. It is not going to help them pay past utility bills. It is not going to necessarily make a difference in terms of education equity. Like there are impacts here that will long outlast the actual physical stress of the virus. And that is something that we as the league have begun to deal with and are wrestling with in pushing our partners, pushing policy, pushing lawmakers, pushing other folks to really think about and engage in how do we truly start to work about holistic solutions. And so, but there is good news in this, right? Like there is in that we have seen, and I say it's good news, but it's also kind of sad how very quickly we can respond to these types of things, right? So we have employers who before were never about this idea of you can work remotely. Now magically everybody can work remotely, right? And so where you had stress for families who were like, well, if I need to be at home to take care of my children, I've got somebody that I'm caring for, like, is it possible for some reason for years, for some institutions, like that was just unheard of. We can't do that. How's the work going to get done? Yet magically, we hit a pandemic and we have figured that out, right? Like everybody can work from home. You can do this work wherever you are, and we can keep this thing spinning. And so that is, in many regards, good news. We hope that people will remember that as we, at some point, come out of this pandemic, that it somehow won't return to business as usual, and we forget that, oh, okay, we were able to do some things without everybody being in the same space. During this time, we saw pay raises for quote unquote essential workers, whether it be folks working at grocery stores, frontline workers at hospitals, a whole host of other people, because they needed those folks to come in. Now, for years, we've had people in industry complaining about like, well, we can't pay them, the system can't support it, you know, these pay increases are gonna bankrupt us, whatever. But all of a sudden, they found the money to be able to support individuals who need it most. Healthcare increased in many regards for those individuals. What got covered, what you were able to do and pay for your benefits. We were magically able to find the resources to get that done in the midst of the pandemic. We've been able to increase access for folks who are on public benefits. It was during COVID-19, during this pandemic, that finally individuals who are on food stamps were finally able to be able to use Kroger's click list to access groceries. For some reason, that was prohibited before that. We could not use food stamps online. That was just something that could not do. That was beyond the pale. Magically, we were able to figure that out. And so there are lots and lots of different things like that that we know we can now do. Education has figured out ways to reach students in new ways, to give them access to technology. The idea that every student now can have a computer, we have found the resources to do that. We've been talking about the need for that for years, but now all of a sudden we can figure that out. And so we have to continue to build on that. We have to be able to innovate around these things to figure out how we can resource and support communities equitably, to be able to help them thrive and get them to the places that they deserve to be. Because again, these things aren't an accident. These things are built on top of policies that were intentional and designed to do intentional harm or to withhold intentionally from certain people. And so we have to begin to unravel all of that. And so again, in none of this is even talking about the unrest and the racial injustice around policing and what that means in terms of systematic racism and the justice system and all of those types of things. I think more than anything, what COVID has done, it has taken all of the sores and just the nasty underbelly of our society and laid them bare for everybody to see. Right? It's not that any of these things are necessarily new. These were all problems before we ever had a pandemic. The thing is that now we're just kind of able to see them all under the daylight in ways that we may not have been able to do. And I say we, I mean us globally, are able to see these things under the daylight in ways that we have not been able to see. And we're able to see how they all connect. And I think for Black people, that is helpful, because I think it is something that we certainly here at the Urban League and other service and civil rights organizations have been saying, that these things are all interrelated. Like, you can't touch one without touching the other. It's not about fixing this sector and somehow magically solving the problem. These things all hinge on one another. And despite the fact that there's tons of evidence to support that, that is often a very difficult case to make for the general populace. But now it is not, because now everybody is able to feel these effects in ways that they might not otherwise be able to. Now, the personal wealth that an individual may have, while it may shield them from a lot, it is not shielding them from the complete and totality impact of what COVID is doing. Everybody is forced to reckon with this thing in one way or another. And in doing so, they are forced to see the inequities that exist in the system. And anybody who is denying that or trying to rebut that is simply lying to themselves. And that is just very, very clear with what we are dealing with across the country. So for our part, like I said, we are working on all of these things. We are continuing to help people find work. That work is still going on. We are helping people to train and get into jobs, because there are places that are still hiring, and we are doing our best, to place individuals as often as we possibly can. Even in the midst of this, we are pushing and supporting our educational system. We are working with them to find the best solutions for families, so that we don't have the learn loss, and so that we don't have students falling through the cracks during this critical time. And so we are working every day, both directly with students and families, but also with the district, pushing on them, supporting them, helping them to figure out what are the best solutions for our community. We are still advocating on things like voting and voter registration, because that is still important, if not the most important thing we could be doing right now. So we are still making as many attempts to get people registered and prepared to vote in November as we did in the primary. We are still helping folks with housing, and so for folks who are looking to purchase homes, who are looking to get out of situations where they may be unable to pay their mortgage and support families. We're doing that work as well. And then we're doing kind of this overarching justice work. So we got together when COVID hit. We started meeting with a group of Black nonprofit leaders, really to talk about how this was impacting them, what they were doing, and where can we support one another. In the midst of all of that, obviously, everything surrounding Breonna Taylor began to happen. And so we put together a document, a path forward for Louisville, which is essentially a list of holistic solutions and demands on the city and others for ways in which we can begin to immediately support the Black community here in Louisville, and begin to make substantial changes and systematic changes to impact the lives of lots of people. And so we are pushing on that in lots of different ways, looking to raise money, to support community-based solutions for our community, and pushing on every single button that we can find to bring those things to bear for the Black community here in Louisville. And so, I will wrap up just by saying that, this truly is an intersectional issue, and it always has been. But it is clear that that's what we have going on right now. And we have to figure out, we collectively as a community have to figure out what we're going to do about it. Are we going to continue to allow these issues to drag all of Louisville and subsequently all of Kentucky and truly all of America down? Are we going to allow the status quo to persist, which is going to have grave consequences for all of us? Or are we going to step up and do the hard thing, but also the right thing, and begin to make equity a priority, and begin to find solutions for people and communities who have been intentionally harmed long before COVID was ever present in our lives, and begin to make some serious solutions, some serious systematic solutions that are going to help everybody thrive moving forward. So that, I think, is our challenge. That's our charge. That is certainly what the Urban League is about, and where we are pushing and moving at every single place that we can. We are trying to do that work. We are trying to push and emphasize that work. And so we hope to find ready and willing partners at every turn. So with that, I thank you all, again, for the time, and look forward to our conversation.
Thank you, Mr. Pryor. We're going to now take questions in the chat, and Dr. Yankee Love is going to help us to navigate those questions. I'm going to start out with a question, if everyone doesn't mind. And today you have an audience of right around 30 individuals who work in various capacities in healthcare and community services. Many of us, our focus is on older adults who have been impacted significantly by COVID-19, especially in the African American community, and others who work with a variety of populations. So having us as captive audience, and you did speak to the fact that Urban League is looking for partners all the time. What would you say to us this morning in terms of what we can do to impact change as it relates to COVID, but also in other justice areas as we try to serve the community?
So there's a lot. I would say one is check your surroundings. Hey, in the places that you work, the organizations that you're in, look around and look and see who has power, who has a voice, and see if that is an equitable space. So you can start right where you are. And are there voices around your tables of leadership, and more specifically around your tables of power? And now I say those things differently because there are places where there are quote unquote leaders sitting around the table, but those leaders don't necessarily have the power. And that's just an organizational thing. Depends on how your organization is set up. Again, I worked at a university for a long time, and so I'm used to being at tables of leadership that don't have power. And so particularly where decisions get made, are there voices there that represent equity, that are going to speak about the need to serve all populations proportionate to their situation, right? And so if that is an issue, then start there, right? Like start looking at, all right, how do we change these dynamics of power to begin to have an impact on the work that we're doing? And then beyond that, it is taking the work that you do and looking at holistic solutions, right? And so, again, if you're focusing on it, and our CEO is really great at this, because this is true in lots of places. People tend to want to fund and support programs and services at the ends of the spectrum in terms of life, right? So we want to help kids, we want to help old people. And that's not to say that those things aren't important, helping kids and helping old people. But if you are helping a child and you want to pour a whole bunch of resources in, and we see this all the time with the league, people come to us and they say, we'll give you all the money in the world, you just got to spend it specifically on this child. Don't spend it on an adult. Well, who is responsible for feeding that adult or that child? Who's responsible for getting them to where they need to be? Who's going to make sure that, you know, that they are safe and well in their home? Like, if we aren't taking care of the adults in that household, then it doesn't really matter how much money you spend on that child, because you really haven't done much to impact their situation. And I would say the same is true on the opposite end. For our older adults, many of them are in the care of somebody else, whether that be directly in the care of, or they are reliant upon. And we have a program here, USJP, our Urban Senior Jobs Program, where we have individuals who are 55 and older, who we are trying to re-engage and get entered into the workforce. Many, many, many of those individuals are reliant upon sons, daughters, grandchildren, nieces, nephews, neighbors, whatever, who are there to support them in doing whatever it is that they need to do kind of on a daily and weekly basis. And so we aren't supporting families, if we aren't supporting whole people and thinking about ways in which we can impact households, however that household is constructed, then we're missing the mark. And so thinking about these programs, and so yes, your focus may be on older adults, it may be on children, it may be on wherever, but you really have to think in terms of household support. What are we doing to hit as much of that household and support as much of that household as humanly possible? And so those are things I think, you know, just right within your own organization that you can do. And then I am putting in the chat a link to a website. I mentioned a path forward for Louisville. And so this is the document that those leaders, those nonprofit leaders got together and did. And so one of the cool things about this site is it actually kind of allows you to figure out where you can get involved. If you click on what can I do, there's a section of the website that allows you to kind of identify where you are. And there's and it takes you to the priorities that we've outlined in that document and says, you know what, here are places that you can help that are specific to right here, right now in Louisville. I would encourage everyone in your organizations to look at that and figure out, like, okay, how can we get involved? How can we invest in one of these things, whether that be a monetary investment towards those aims or a partnership in some way? Like, how can we come alongside and help to support this work?
Thank you. Are there any other questions in the chat, Pam?
Not at this time.
So this is Dr. Furman. So Mr. Pryor, I just want to say thank you for sending that website. That's because I was going to ask for that, because I think our institute, you know, we have a lot of connections, and we were able, maybe, you know, we're trying as an institute to figure out our path forward with, you know, racial injustice, and maybe we could just use that as a document instead of, you know, recreating the wheel, just, you know, do what you say in that document. But I also appreciated your story about the patient that was going to have an amputation. You saved his leg, because I think, you know, as a healthcare provider, you know, our institute, I mean, that's what we are as healthcare providers. And so, you know, we can do a lot about that trust issue. And I think, you know, like you said, we have to look at ourselves and what are we doing to make sure our patients feel comfortable with us and trust us to really help them get better. So I think the University of Louisville, I was talking to residents in internal medicine and just being around the university and the School of Medicine. It's changing, but it's been an all boys club, and not a lot of diversity and not a lot of welcoming. And so I think we need to look to ourselves and fix it, you know? So, so our institute is very much willing to work with the Urban League. Sadiqa Reynolds was our first speaker for our first Gold Standard Award for Optimal Aging Luncheon. So we love Sadiqa, and we have a good relationship. So anything we can do to help, you know, I think we would love to be a partner with that.
Awesome, thank you. And I love the idea of hearing, you know, you all expanding the network in terms of who's a provider and that sort of thing, because that's something else I think that's really important in this conversation. And so where are kind of those non-traditional healthcare providers in this, and how are we supporting them? How are we bringing more providers of color and into the fold? And so, you know, and we've had specifically the conversation around mental health providers the Black community in terms of them having access to more of the community. And it's very difficult, because if you are not one who takes Medicaid or Medicare, if you're not connected with an insurance provider, then you're out here struggling for grant dollars so that you can supplement community members who want to come and use your services. And so how can payers and others begin to support those providers? And I don't know a whole lot about the process for getting that, but from what I'm told, it's not necessarily an easy one to kind of get up under the umbrella of some of these payer systems. And so what are we doing to bridge that gap for trauma-informed and providers of color who should have access to broader populations of the community, and again, those non-traditional practitioners, community health workers, nurse practitioners, doulas, midwives, those types of things, because we can have a whole other conversation about Black maternal health and all of that sort of stuff. And so how do we begin to fold all of those individuals into the system? Because right now they are at the margins, if they are in it at all. But we know that they provide a truly remarkable service oftentimes for those marginalized populations. And so how do they become part of the fabric, an integral part of the fabric of what we do and how we serve individuals?
So, Mr. Pryor, hi. There is a question that, little segue there about, from Andrea. It says, I wanted to see if you were aware of any work being done to help young Black women improve their reproductive health literacy, whether it's learning about their reproductive health in general, sexual health, contraception, and pregnancy birth options. It's a passion of Andrea's, and it's one area that she wants to get more involved in, as well as there's several of her colleagues that are in the women health community.
Yes. So through this role, I've been connected with some doulas and midwives, and so I know that there's a growing network in Kentucky, actually, that is happening, and I'd have to find that information. And actually, prior to COVID hitting, we were in talks with a young woman who was actually going to do a Black maternal health conference, specifically around this issue of the Black community and in reproductive health. And so obviously that has been put off a bit, but yeah, if somebody wants to contact me, I can put you in contact with those individuals that we have, but we need more of that. I think that it has gotten some attention as of late. Unfortunately, kind of with the incidents that some of our popular Black personalities like Serena Williams and others who have experienced things, and now and those stories have become prominent. But we know that has been an issue for a long time within our community. That the maternal health for Black women and babies is devastating and disproportionate. So yeah, we've got to do more to bring attention to that. And I certainly think now, following that, as we are learning more about the impacts of COVID on pregnancy and newborns and all of those types of things, like the way in which we need to pay attention to this is certainly elevated, because there's so much that we don't know. And then when you add that to the way in which Black people are often already treated in the system, it's a recipe for disaster. So I completely support any efforts to expand our knowledge and research and understanding of Black maternal health.
Yeah, this is Christian Furman again. One thing I want to follow up on that you said about voter registration, I just, Justin Magnuson, who works for us at the Institute, sent this about an ER physician set up a voter registration in the emergency room, and now it's really gone viral. And so, because all these people are coming in so sick, they have no insurance, and some of them work in the healthcare industry and they still have bad insurance. And so really it's your vote matters on who makes these policies. And, you know, some people are trying to get rid of Obamacare and everything else. So the Affordable Care Act. So yeah, I think our institute, we're going to try to get those kits, and part of our annual wellness visit will be, okay, did you get your flu shot? Okay, did you register to vote? Okay, this is how you vote, you know. So it's really, I think that's what, I think you're right. The COVID epidemic has made, pandemic, people have realized there's such a connection between health and the economy and voting. So yeah.
Absolutely.
So we have a question for you, Dr. Furman, that might lead to another question for Mr. Pryor. Can you help us understand the positivity rate and what it really means? You
So
gave
yeah, I
some
think
high positivity rates earlier.
right. So I think, you know, it gets confusing because, you know, you've heard, oh, California surpassed New York is the number of COVID cases. But if you look at that list of where the self-quarantine is supposed to happen after going to those states, California is not on that list. Well, it's because California it's a huge state with a huge population. So you can't just look at absolute numbers because it's a percentage that you have to look at. So the positivity rate is all the people that have been tested, and others people tested, how many became positive. And so it kind of helps level the playing field for small states, big states, you know. And that's, people say, oh, the number's up because we're doing more testing. Well, really don't look at the numbers, look at the positivity rate. That's what really tells you what's really going on. And so like Kentucky, like I said, had gone from 2% to 4%. And over the weekend, it went to 5%. So that's why on Monday, the governor made these new guidelines, because once it's more than 5%, you're supposed to have, you know, universal masking, nobody more than 10 people, you know, bars closed, restaurants decreased capacity. So, and then the 15% is these states that you should not travel to, or if you travel, do a 14-day quarantine. And that's like, you know, Alabama, Mississippi, Arizona, Florida. But California is not on that list, even though they have the most number of COVID cases. So it's the positivity rate. And it's interesting because even if you're positive with COVID, some people, like especially we had this whole testing at our nursing home, people came back positive, but they had 0 symptoms. So you can be positive and have no symptoms, but that's the person that spreads it to the next person. So that's why you want to know. But just because you're positive COVID doesn't mean you're in the hospital on the ICU and can't breathe, you know. So I think the next thing would be nice to see is, you know, is it asymptomatic positive or just positive? They haven't, you don't see any data on that. It's just positive, yes or no. It doesn't say positive and symptoms or not. At least nothing I've seen. I'm sure it's out there somewhere. Like, I'm sure Fauci's looking at it, but not me.
Right.
But that's the positivity rate.
And then for you, Mr. Pryor, statistically, as it relates to positive cases and deaths, how is COVID affecting African American communities statewide and more specifically West Louisville? And are there any efforts being implemented to help mitigate the spread?
So I don't want to get in trouble by misquoting data. So I don't necessarily know the exact numbers or percentages. I'm sure somebody else on this call probably does. And so I will leave that to them. But we do know, at least going back a month or so ago, that it was disproportionate in Kentucky and everywhere else across the country. And so in terms of specific efforts, I mean, I can speak for us. I mean, we are doing at every turn, doing our best to promote wearing a mask and really honestly just staying home. That has been something that we have been trying to push, is that for folks who can and who are able to stay home, to stay home. For those who can't, for whatever reason, please wear your mask, please social distance, please wash your hands, do all of the basic things that we know that we are supposed to be doing in that regard. So that's kind of our effort, is to really push just the safety, the typical safety protocols and responses. As an organization, the league, I mean, we are a front-facing organization, but we have been closed physically to the public since mid-March, and so not allowing individuals to gather in our space, and we have moved as much as possible to virtual and telephonic responses to community. And so, you know, we are doing our part in that regard to try to limit our impact on folks gathering. But again, it's difficult because a lot of who we serve would be considered essential in whatever industry they are in. And so they don't have many options in terms of not being able to work. If you have a job, right now is the time you want to keep that job. And so if that means having to go in and go out, unfortunately, that is the barrier that we're up against.
Barbara, did you?
There's
Okay.
one more question, Pam. It's your question. Did you want to go ahead and?
Yeah. So, Mr. Pryor, I was wondering, I'd like to hear a little bit more about some of the solutions to reduce the learning loss. And one of our colleagues, I guess a few months ago, was talking about, there was an article in which they put a bus in some low income oriented communities, and the bus was a high speed internet oriented bus. So they moved the bus in, and then the kids could actually use, their computers, and it moved around the neighborhood. Just wondering if there are, similar things like that happening, or what other solutions are going on to reduce the learning loss that you spoke of?
So JCPS has responded to our Path Forward document with some solutions, and there are more that are coming. So they are committing to tech equity, as we call it, which is getting every student, hopefully, a digital device, a computer of some sort, which is huge, because in the spring the goal was to get every household one. So if you had multiple kids, you might be sharing one computer. Our push and the push from others in community was that every student needs to have one. If you've got 2 or 3 kids, sharing one computer just really isn't going to be the way to work. And so they have committed to find resources and find ways to get every student computers, and then to the best of their abilities ensure internet access through things like hotspots and others. That one, I think, is going to be a taller order, and they're going to need, we as a community are going to need more support from others to ensure high-speed internet access is readily available for all of our kids in the system. But that is a huge step, because again, if we're doing this whole thing remotely and you can't access it, you're already just in a significant hole. Beyond that, I know that the district is going to be making some announcements with regard to the platform and the system, and what quote unquote NTI is going to look like. And so we have been engaged in some of that conversation, at least as an advocate. We're looking for a solution that makes sense, because when it comes down to it, what we recognize, and I live this now. My wife and I have 2 toddlers. Well, one who's about to start kindergarten. She will be a kindergartner this year, and then a true toddler, a 2-year-old who wants to get into everything. And we both work full time from home. And so the stress of trying to do all of those things, even now, there's no school happening, just the stress of trying to manage that for both the child and for the parent is extreme. And I am speaking as somebody who we have a tremendous amount of privilege, right? Like our kids have access to all kinds of stuff to do and occupy themselves and all of that, right? Like, we are not necessarily stressed in that regard. And even still, it is a tremendous amount of stress to undertake. And it is something that I see in my kids, and something that I recognize, that the impact that it happens on them, because what they want, particularly at that age, more than anything else, is attention. And if you are working full time, it is very, very difficult to give them that attention throughout the day. And so when you scale that up for kids who you know, certainly younger kids, elementary school age kids, that does not change for a long time. But even for kids who are older and who need, you know, assistance with things, who need help with this work, or who need to understand this assignment better, or whatever the case may be, if you are a parent who cannot be at home during that time, or who even is home, but who is engaged in full-time work, like, what does that mean for you? So we are truly pushing for, to the best of their ability, for JCPS to think about truly holistic solutions, platforms that are going to be able to engage and help navigate kids who may be experiencing all different levels of engagement at home. And so that's what we're hoping to see. And I know that the superintendent will be talking more about that in the weeks to come as school nears, but in terms of mitigating learn loss, that's just what this is. That is a significant part of it, is truly dealing with the psychological impact of, we're all at this house or not, but we've got to manage all of these competing things at the same time in a way that we've never had to do that before. And how do we address that in holistic and compassionate and equitable ways? And that is a very, very hard thing to do. And so, you know, we applaud JCPS for the efforts that they are making, because it is nobody, no district doing that has that easy. It is very, very difficult to try to figure that out for as many kids as they have. But it is absolutely essential. And again, going back to what I said earlier in terms of the impacts long past COVID, if we don't get this at least semi-right, the impact that we're going to have on kids for generations, right? Like the lost learning that'll happen there, and what that means for those kids as they go on to graduate and all of that sort of stuff, the time in which we might lose in this is simply critical. And there is no denying that is so important. We have to think about this not just for today, not just about for 2020 or 2021. Like, this is a generational conversation that you have the potential to mess some things up for a generation of kids who are in schools. And so where possible, cities, states, governments need to be able to bring all resources that they can to bear to ensure that equitable, safe, and truly beneficial learning in whatever state, you know, whether that's at home or whatever, is happening for our kids. It's critically important.
Thank you, Mr. Pryor. And with that realization and heavy weight, actually, we're going to conclude this session. We really, really appreciate you being with us today. Your discussion, your information, and this conversation has been very enlightening. The work definitely must continue. And we appreciate you being with us, and appreciate the Urban League being part of this effort. We're going to issue another poll, so we want to encourage everyone to stay on and please take the poll. This is helping us to guide what we're going to do in the future. So if you would take this poll before you exit this informational session today, I would really, really appreciate it.
Again, thank you all for having me. You have a great day.
Thank you, Mr. Pryor. Thank you very much. And again, we'll, as we continue these informational sessions, we'll definitely probably reach out to you all again to participate and help us to form our future.
Well, Sadiqa, hi.
Will do. Thank you all very much.
Thanks.